Many people experience uncomfortable vaginal symptoms at some point in their lives. Two of the most common causes are yeast infections and bacterial vaginosis, or BV. The tricky part? These conditions can feel very similar, but they have different causes, treatments, and even risks if left untreated. In today's video, we'll break down the differences between yeast infections and BV, how to recognize them, what causes them, and when it's time to see a doctor. Let's start with what they actually are. A yeast infection is caused by an overgrowth of a fungus called Candida albicans. This is a type of fungus that naturally lives in the vagina in small amounts. When the balance of yeast and bacteria in the vagina is disrupted, yeast can multiply, leading to symptoms like itching and burning. Bacterial vaginosis, or BV, is different. Instead of yeast, there's an imbalance in the healthy bacteria in the vagina. Normally, healthy bacteria called lactobacilli keeps the vaginal environment slightly acidic. In BV, harmful bacteria commonly known as Gardnerella vaginosis grows and outnumbers the healthy bacteria, changing the vagina's pH and causing symptoms. Now, how do the symptoms compare? With a yeast infection, the most common symptoms are intense itching and irritation around the vulva, a burning sensation especially while urinating, thick white discharge, often compared to cottage cheese in texture, and redness and swelling around the vaginal area. With BV, the symptoms are often different. A thin, grayish or white watery discharge, a strong fishy odor, especially after sex, and mild itching or irritation, although some women have no noticeable symptoms at all. While both can cause discharge and discomfort, the key difference is that yeast infections usually cause thick discharge and intense itching, while BV often involves a strong odor and thinner discharge. Both yeast infections and BV are linked to imbalances in the vaginal environment, but the triggers are different. Yeast infections may be triggered by antibiotic use, which kills healthy bacteria, hormonal changes like pregnancy or birth control, high blood sugar or poorly managed diabetes, wearing tight or non-breathable clothing, and stress or a weakened immune system. Meanwhile, BV is often linked to multiple or new sexual partners, although BV itself is not considered an STD. It is also linked to douching, which disrupts vaginal balance, smoking, and natural changes in vaginal flora. It's important to understand these differences because they can influence not just treatment, but also prevention. So, how do you tell them apart? For sure, self-diagnosing is tough because the symptoms can overlap. That's why healthcare providers use tests. For yeast infections, a doctor may take a swab of the discharge and look at it under a microscope. For BV, they may examine the discharge under the microscope as well, but they can also test the vaginal pH. BV usually shows a higher, more alkaline pH. Since treatment for each condition is different, an accurate diagnosis is really important. Treatment is where things really set these conditions apart. Yeast infections are usually treated with antifungal medications. These can come as over-the-counter creams, suppositories, or prescription pills. BV, on the other hand, requires antibiotics, either in pill form or vaginal creams and gels, most commonly metronidazole or clindamycin. Antifungal creams that work for yeast infections won't help BV, and antibiotics for BV won't fix a yeast infection. So, if you are frequently treating yourself at home while continuing to have worsening symptoms, you may be using the wrong over-the-counter medication and should see your doctor. So, how can you lower your risk of getting yeast infections or BV? Well, wearing cotton underwear and avoiding overly tight clothing can help. Limiting douching or scented vaginal products is also important. If you have diabetes, keeping your blood sugar under control matters. Practicing safe sex and limiting unnecessary antibiotic use can make a difference. And considering probiotic use for both healthy gut and flora might be helpful too. So, when should you see a doctor? If it's your first time having symptoms, if symptoms keep coming back, or if over-the-counter treatments don't help. It's important to get checked. Also, if you're pregnant and have BV, treatment is especially important because untreated BV has been linked to pregnancy complications. To sum it up, a yeast infection is caused by fungus and usually brings itching, burning, and thick discharge, while BV is caused by a bacterial imbalance that often leads to a fishy odor and thin discharge. Knowing the difference matters because the right treatment depends on the correct diagnosis. If you found this video helpful, be sure to like, subscribe, and share so more people can learn about vaginal health. Thank you for watching.